You know, when you hear the words health and medicine, what pops into your head? Probably a doctor's office, right? Or hospital. But the real story of our well being, man, it's so much bigger, way more complex, and honestly, just a lot more interesting than that. So let's just dive right in and explore some of the essential and, yeah, sometimes surprising fields that really define what our health is all about.
Okay, so I'm going to start with a question for you. What does health actually mean to you? Seriously, is it just not being sick? Is it about hitting the gym? Or is there something more to it? Just hold that thought, because we're about to see just how huge the answer to that question really is.
And here's the thing, the most important point, really. Health isn't just your journey or my journey. It's a collective story. It's woven through our communities, our environments, and even through history itself. At the end of the day, it's the story of all of us together.
Right. So to really get a handle on that collective story, we got to start at the foundation, the bedrock, and that is public health. This is where the whole modern idea of keeping entire populations safe and well really gets its start. I love this quote. It just frames the whole field perfectly. It's not just about policies or charts, it's a battle, right? Humanity versus disease. And this isn't a new fight. It's a battle we've been fighting for centuries. And our main weapons? Well, they've been science, new ideas, and big social changes. And just look at this timeline. It shows you how long this fight has been going on. I mean, it goes way back, starting with really foundational ideas, like ancient civilizations figuring out they needed sewer systems, or Venice pioneering the idea of a quarantine to stop the plague. Then, bam, a massive leap forward in 1796 with Edward Jenner's first vaccine. A few decades after that, you get John Snow, who literally tracked a cholera outbreak in London down to a single contaminated water pump, and in doing so, basically invented modern epidemiology. All of these efforts started to go global, with organizations like the WHO leading the charge, which led to something incredible: the complete eradication of smallpox. You see how each step just builds on the last, protecting more and more of us? Okay, so let's build on that, because the fight for health isn't just about germs we can see under a microscope. It's also about the very world we live in. I mean, our environment. It plays a massive role in our well-being. And the field that studies this is called environmental health. And what it really gets at is this critical feedback loop. It looks at how our surroundings, the air, the water, the land, how all that stuff affects our bodies. But just as important, it also looks at how our actions impact those surroundings, which, you guessed it, comes right back around to affect our own health. So this isn't just some abstract theory. Let's look at a really powerful and pretty devastating example of this connection in the real world. Agent Orange. So this stuff was used as a military defoliant. Its whole purpose was just to kill plants. But the consequences, they went so far beyond that. It caused catastrophic long-term damage to the entire ecosystem. And for people, wow. The human impact was multi-generational. It led to cancers, all kinds of severe health problems, and just a tragic number of birth defects that hit not only the Vietnamese population, but also the military members who were exposed. It's just a brutal reminder that what we do to our environment, we ultimately do to ourselves. And of course, environmental health is way bigger than just one chemical. It's this massive field that touches our lives every single day. We're talking about the quality of the air we breathe, the safety of our water and our food, even how we manage our trash and get ready for disasters. It's all connected. Okay, so we've gone from the really big picture, whole populations and entire environments. Now let's zoom all the way in. Let's look at some of medicine's most specialized frontiers, where the focus totally shifts from the health of the many to these unique and very specific human challenges. Check out these two super specialized fields. On one hand, you've got gerontology. Its goal isn't just about helping us live longer, it's about helping us age better. Improving our quality of life by minimizing the disabilities that can come with old age. And then, on the complete other end of the spectrum, you have forensic medicine. This is where health smacks right into the law. An autopsy isn't just a medical procedure. It becomes a tool to answer legal questions about how someone died, providing absolutely crucial evidence. I mean, two totally different ways to apply medical knowledge, right? But what if healing doesn't come from a scalpel or a prescription? What if it comes from something else entirely? And that brings us to a field that completely blows up our definition of medicine: the rise of art therapy. And look, it's a totally fair question to ask. We think of art as something for a museum, right? Something to hang on a wall. But can healing really come from a paintbrush or a lump of clay? The answer is a huge, resounding yes. But the why? That's what's really important here. So the key difference here is all about the focus. Mainstream art is often about the final product. How good is it technically? How beautiful is it? Can you sell it? But in art therapy, all of that it falls away. The focus shifts completely to the process of creating something. It's all about self-expression and the individual's journey, not the finished piece. So, how does this process actually heal somebody? Well, for one, it lets people express these really deep feelings that maybe they just can't find the words for. It can bring unconscious issues to the surface, but in a really safe way. The very act of creating something empowers people, it helps them feel valued. It can be an incredibly powerful tool for working through personal trauma or social stigma. All right, let's try and pull all these threads together. What we've really seen is this incredible journey, right? From the absolute broadest sense of community health all the way down to the most personal, intimate forms of healing. What it shows is a constantly expanding circle of what we even consider to be care. Think about it. We've gone from the basics of public sanitation and vaccines all the way to the super complex interactions of environmental science. We zoomed way in on the nitty-gritty science of aging, and then we zoomed right back out to the deeply human process of healing through art. At the end of the day, the story of health is never just one thing. It's never static. It is a story of constant expansion. It's always growing to include new ideas, to face down new challenges, and to find new ways of understanding what it truly means to be well. And that kind of leaves us with one last question to chew on. As our world, our technology, our environment, as all of it continues to evolve at this dizzying pace, what comes next? What's the next essential discipline going to be? And what will the very definition of health look like tomorrow?